had low back pain since you were very young, right? Yeah. Like you're saying 12. Yeah. And since September, you've been having the pain in your calf? Let me get this right.
July last year. So July about a year ago.
And it changes. It shifts from her calf to her thigh.
It's moved up to my hip as well.
And it's a little confusing. Most people, when they have sciatica, they'll feel it go down their leg. Hers is kind of going up. So I have a theory that maybe her disc is centralizing on its own. Centralizing meaning is as the disc kind of goes back into place, the pain will come up higher and higher and higher, and then the last thing to go away is your low back. Mm-hmm. Yeah, and she has this right high shoulder. A lot of tension in your neck, right? A lot of T8 here. It is just swollen. It's actually swollen. Like it feels like it's squishy. Like with fluid.
Yeah.
Can you feel this high up on your back? Can you feel that?
That's weird because I thought that was like normal.
Okay, but it's not. It's only here. It's not up here. Yeah. So, here we go. We're gonna go on your back, face up. Let's do a couple tests. A couple orthopedic tests. Yep, perfect. And I did kind of notice. Let's test it again. Legs feel normal temperature. We did some dermatome testing, and she feels numbness on the outside of her calf and down the outside of her foot. L5 nerve root. Okay. No numbness here though, right?
No, not right now.
She's not saying anything here. But when it is pain here, do you feel like it is numb?
Yeah, it's like numb up to maybe the top of my hip right here.
Okay. So I have to determine how bad this is. And any pain here when I do this?
No.
Any pain in this leg?
No.
Okay, and then down. On the other side. I'm just going to feel your low back. I got your leg. Let your leg go. I got you. Yep. Any pain there?
Not pain, but it does feel very tight.
I'm feeling your low back engage when I do this.
Mm-hmm.
If I keep your pelvis down, is that any better?
Yeah.
All right. Bend your knee. Pain here?
No.
Pain here?
No.
Okay. Bend your knee for me. This feels fine. No pain?
No.
Yeah. All right, so now we're going to go on your stomach. I'm going to give you some face paper. Remember, I will warn you if I crack. I'm not anywhere close to cracking you. We still got a long way to go. You got to earn your adjustment. This is definitely a PI ilium, posterior ilium on the left. Let's confirm it with the leg check. She's got a short right that stays short. And that corrected it. Okay. So what I'm going to do is just do some palpation here. Oh, do you have a constellation on your back?
Yeah, I do.
Which one is it?
Cancer.
Any pain here when I'm pushing? This is that region I was talking about again.
It's not really pain, it's just I can feel it tightening like a lot.
When I push on it?
Yeah.
More pain over here on the right than the left? Tenderness?
Yeah, for sure.
Yeah, there's a rib out of place over there. So that kind of holds it together here. Go ahead and you're going to look to your right. Don't worry about the paper yet. Oh, look down again. Okay, and then look to the left. That changed it. Okay, so we have a cervical issue as well. Look down. Problem in your neck. We're going to have to clear the neck out first, okay?
All right.
Now, left arm above your head.
Oh, left.
It doesn't matter. Yeah, go ahead. All right, then go back. That overcorrected it.
Like?
Yeah, sure. You can go that way too. Yeah, definitely this left side. All right, and arm down again, and then we're going to do same thing right hand side. Perfect. Okay, I made it worse. And down. These are my checks. And behind your back again. Go. That made it better. All right, and down. All right, we're going to flip you over on your back.
All right.
So your hands can go here on your stomach and then scoot up towards me this way. We'll get the most nerve-wracking one out of the way.
Okay.
All right, she was really nervous about her neck. So, again, I'm not going to crack you right now.
Okay.
Or adjust you right now. If you feel like you need water, let me know. We can stop.
All right.
Some people get really thirsty. Right, Atlas. And it continues down the right-hand side.
It definitely feels a little bit worse on the right side.
Yeah, I'm feeling that swelling.
Yeah.
Nothing at first blush here on the left.
Mm-hmm.
So here we go. We're going to do massage first, okay?
Okay.
These things that you've had, they've been here a while.
Yeah.
This has been here since you were born. This is an old injury. Everybody's like, how could a baby have an injury? I'm like, yeah, and birth is no picnic. Birth is just, a piece of cake for the baby. You okay?
Yeah.
I'm going deeper and deeper. Here we go. Have you ever had a massage before? I forgot to ask you that.
I have not.
It doesn't seem like you've had. I don't think you've ever.
No.
I don't think you've been fiddled with ever. So it's like, maybe I go easier? Are you okay? I apply firm pressure so it doesn't tickle.
Yeah.
Okay. Because I'm on the back and it's right, where the nerves exit the spine. So people go, ooh.
Yeah.
Now, do you mind me saying the thing about shingles or do you not want?
No, that's okay.
So, she said she had shingles and it was up into this side above her eye. And how long ago was that?
That was when I was maybe
2 years ago?
3 years ago.
18? Yeah. Okay. I'm curious, though, to see what's over here. Okay. I think it was more of a cranial nerve because she said it was up. I mean, if you ever get shingles up in here, anybody, you go to the doctor and you get an antiviral. It's just too close to the eyeball. It sounds like it was either a trigeminal nerve or a facial nerve that got infected. She still has, the little scar. Yeah, you still have a couple of them here, here, and here.
If you, look super close, you can see them.
Yeah, I see them. So...
kind of hurts the acting, but it's okay.
Oh, because you said you dropped out of acting? Or
I
had to just stop
I
for a
just,
few
I
weeks?
had to stop school just because I just couldn't get back on track because I had been out of school because of the shingles, and I just had to stop, but...
Oh, man. So anyway... So any tenderness back here?
A little bit, yes. Yeah, it's a little bit painful there. Not painful, but sore, definitely.
It's just that it's so interesting. I'm gonna have to look it up. The way that I remember it from school is that shingles or the chickenpox virus lives in the dorsal root ganglion, and I believe the dorsal root ganglion is only in spinal nerves. It's a peripheral nerve. So whereas your pattern is more like a cranial nerve. I have a funny story about that. One of my professors walked in with it once in chiropractic school. Same, just like what you're saying, all in his eye.
Mm-hmm.
And that's when this is our professor, our chiropractic professor, and he's like, when it gets bad like this, I want you all to remember, if you ever see a patient like this, send them to the MD and get antiviral medication. Like a note tape. You don't need to tell us that. It looks so bad,
Oh, God.
And he, how long did you say it took before it went away?
The actual, shingles on my face, maybe, a week and a half.
After the medication?
Yeah.
Yeah, you don't mess with that stuff.
Yeah.
He was like, yeah, it was starting to go into my eyes, so.
Yeah.
But he wasn't, we were like, why did I don't even remember his name. What was his name? Oh. He was our class speaker, too. I don't know why I forgot. Starts with an L. Oh, anyway. But that's where I learned that from. It was an actual professor at I'll probably have to cut that out.
Yeah.
It's just whoa.
It's very alarming to see that. Yeah.
And he came in to us after a while, after he had already been treated, and we're all like,
Oh, yeah. I looked like Two-Face Like, seriously, half my face was like...
I'm so sorry. That's bad. But anyway, I have to be careful, like, when I touch up here, because are you still experiencing some...
Not usually, unless I get very, very stressed out. It gets a little bit red up there, but other than that, there's no pain or, like, soreness or anything.
Yeah, usually people are very sensitive, like, to hot, cold, or they can't stand anything touching it for a while afterwards. Yeah. I felt you flinch, and I went, I better look down. See, I don't look down, and I keep my chair back like this, so I'm keeping a curve in my low back and a curve in my neck. So I'm doing this by feel. I'm not sitting here looking at your neck. I've trained myself to basically find this little gutter on the side of the neck where the nerves exit and to get them to come loose. I know you feel it.
Yeah.
Okay, here we go. Good. This is where we're going. I'm not going to adjust. Just track. That's it. This is what I am going to crack right here.
Okay.
This is worse than the adjustment. Okay. This is worse. C1 feels good. Take it down. This one's difficult. I'm sorry. That one right there, C2 and C3. Next level down in the neck. Muscles are just... How often do you look down during the day? Are you looking down to text? Are you looking down...
I would say...
Typing?
Probably a lot. I don't usually honestly notice, and I would say that means probably a lot.
You're looking down a lot. Let's just put it that way, because
I mean, my head feels like it's constantly going forward, so like that could have a lot to do with it too.
I'm trying to like train this to be more pliable, to go backwards, and it's fighting me every step of the way. Because here's C3, C4. No dizziness, nausea, vertigo, anything like that when I'm doing this?
No.
One more time. There we go. We got a little bit out of it. A little fragment of it. All right, we're going to adjust it.
All right.
That's as much as it wants to go right now. Ponytail, sorry. Right here. Now, I've got it in a corner here. Think thoughts.
It wasn't actually that bad.
No, it's not. Okay, we got it. Right here? Oh. Right here. You know it's coming now. Think thoughts right here. You allowed me to get one. Oh, it's all right. Right here. There it is. That was it.
All right.
Worst part over. Yeah, that gave it a little bit more balance. Now chin back for me. That's it. Oh, that's it right there. Perfect. Good job. Now the baby toe is this one.
Yeah.
Okay. And you don't know how it happened?
I have no clue. All I know is it's weird.
Okay. Okay, baby toe. Let's just feel it. It feels like scarred, a little bit of scar tissue on the inside. It doesn't want to go to the side. It doesn't want to come out. Can you wiggle it outwards? Yeah. Now do it to this foot.
This one like goes farther almost.
But you're kind of getting... No, that's you. Okay, that's normal. I'm just making sure that's... Hurt when I do that?
It doesn't hurt.
It doesn't really go.
Yeah.
Maybe you should try this big toe again. I'm learning. I don't know your toes yet. Okay? I don't know them yet. By the end, I usually figure it out. But the baby toe...
Yeah, it doesn't...
I don't...
Doesn't think it wants to do anything.
No, and I'm going to leave it alone for now. So now we're going to do the ankles. Again, this is all information for me. So reach overhead, you're going to grab the table, like that. And it's just fine. more stiffness. See? Is that painful even to do that?
It's not really painful.
Discomfort?
Yeah.
I guess it's tightness.
Yeah.
Stiffness. Yeah, I feel it. This side's just like, wee, and then this side, no. All right, hold on. Hold on, because here we go. Yeah, feel that hip socket separated nicely. Yeah. This one, I'm not sure if it will. I got you. It's tightness. Okay, I told you in the beginning, sometimes this is the loose side, the one that hurts, sometimes it's the one that's tight. This is definitely the side that's tight the whole way down.
Yeah.
Everything that we've done is tightness over here. From here, the whole way down to your baby toe on that side, okay, is tight. Still here. Still need to correct. Here's the sacrum. Remember on the pelvis I was showing you those big joints of the pelvis? That's here and here, okay? I'm feeling for scar tissue. More, it's just in general tighter there. So when let's see here. Any pain when I do this? In your low back?
Not really.
Anywhere?
No, not like that. No.
Pain?
It's definitely a lot harder. Like, it feels like it's harder for that to do that.
Pain?
No.
Pain?
No.
I feel swelling down here though.
Yeah.
Right here.
When you pressed over right here, it did hurt.
I feel it. I feel it here. So when I press here.
Yeah.
Interesting, because this is the one that's sore.
Yeah.
Okay. I've never had a shirt that did this.
Yeah, this shirt's weird. Sorry.
Maybe it'll help me. Hold on.
I was thinking, honestly.
Okay, there we go.
Yeah.
Okay, I see it. This is high here on this side where we were saying it felt kind of spongy.
Yeah.
This side's higher, so this means your mid back is rotated this way.
Okay.
So when we do exercises, you're going to need to lean into this left side in the mid back. Now let's find out. Here's the compensation. Right here. Here's where your shoulder comes up high. Right here to here. All right, it's not hard to figure out, but it's there. Green roller. Okay, big knot there. Any pain here?
Not
tickling?
Pain. Yeah.
Is it pretty ticklish?
Yeah, I am ticklish.
All right, let me hold pressure. That shouldn't be as ticklish. Yes, no?
Yeah, that's all right.
Right here is that sponginess. Does this tickle?
A little bit, but it's not that bad.
Okay, breathe. Deep breaths. Oh, goodness. You gotta push a little harder. You okay?
Yeah, I'm fine.
Here we go. Using a little bit more body weight on you. That's tight. That one's not going to go on its own without some persuasion. Breathe, breathe. This isn't very comfortable, I know. We've kind of already adjusted the mid back right here, but I haven't gotten the upper ribs.
Okay.
So take a deep breath in for me, all the way out. Perfect, easy. For somebody that doesn't crack their back at all, you're pretty loose. All right, and again. Okay, these are a little tight on this side. I'm trying to warm this up. because this is not going to be fun. Maybe this might be all you can handle. I'm not sure. How bad is this?
It's pretty bad.
All right, let's just get it over with.
Okay.
And then it's going to be done. It's going to hum for maybe 20 minutes.
Okay.
And then it's over. Here you go. Breathe. Deep breath in. 1. 2. 1 more. I know. I'm sorry. Okay. Perfect. Done.
All right.
That's about as clear as I can get it in one shot. But there's lumps all along here. 1, 2, 3, 4, 5. Jeez. Is it over here too? No. No, it's not over there. So you gotta work on that back calf.
Okay.
You take like a tennis ball.
Yeah, I actually used to do that when it first started.
Okay, because it's just the communication is not there.
Yeah.
Okay, this isn't as painful as the calf, but it's still not very fun. I'm right at the bottom of the sciatic nerve. 3, done. Take some pressure off of it. There it is. Done. Okay. Go into the 5th metatarsal, see if there's no, congestion in here. And we were saying earlier, I thought it was interesting. She has these 3 tattoos, and you did it to yourself, right? Yeah. And if you look at the old, like mummies that have been buried, and their tattoos, they'll normally tattoo themselves along where they feel pain. But this wasn't really
it was
that.
Not like that. No.
This was you and your 2 friends.
Yeah.
But that's kind of what it reminded me of.
That's really interesting. Actually, I did not know that.
And it's raining again. It must be 3 o'clock.
Yeah, right.
Ta-da!
Cue the thunderstorm.
Yes. This one, breathe. There it goes. Ooh, your toe went with it. Very good. And you're gonna go like this. Good. Then you're gonna your head is gonna kind of be off the table. I've got you. You're not going to fall.
Okay.
I've never dropped one patient ever. Okay, here we go. This is. You're gonna lean back off the table. That's it. That's all it's gonna go. Other side. Which was a lot. Okay. And reach back. This one we've got to pull another way. I got you. You're not gonna fall.
Okay.
Look. Okay. On your back. How'd that feel? Okay?
Yeah.
Numbness, tingling in here still?
No.
Elbow sore?
No.
Everything feels fine there. Got a little bit of a catch here. No, not anymore. It's gone now. Just shaking them all loose and let the pebbles fall over there. There they go. Okay. Like, oh, you're so tiny that I could just kind of grab it and shake it. And those people, I'm like, I'm just like wringing them out. All right, come on, sit up. You're gonna face that way. This is more for the shoulders. Okay, especially when you're saying maybe carpal tunnel, lean away. I've got to make sure that this is okay. That's all.
Mm-hmm.
That none of the bones are stuck. Sometimes I find broken clavicles. I find all kinds of things. I'm like, did you know? And lean away. No, everything feels fine up here. Where I'm going to go is into your shoulders a little bit.
Okay.
Final one here. Go on. I know where I'm going. So I'm going right here. You can get a massage cane and do this to yourself, sort of? Do you have one?
When I was doing that job where I camped for 3 months, one of the people on the crew had one, so I used it, but ever since then, no.
Okay, so you come back in here, you know, and you pull that down. That will eliminate a lot of this tingling. I mean, it's mostly due to just these really tight traps here. Here's the old one. That you just grab, you take that cane, grab onto that meat right there, and then you pull down on it. I had it here, but then we took it home. We're like, we can't go anywhere without that thing. Once you learn how to use it to your advantage, it's pretty cool. But people feel really uncoordinated when they first use it, but I'm like, just keep doing it. You'll get used to it. When you're in pain, you'll figure out how to use it. Ooh, there's that one. There's nothing to do here but just to sit and wait. I get it started for you. Okay, that's basically my job. Get this started so that you can do it yourself. And that's pretty good. Check under, here's the clavicle. Checking right underneath the clavicle. Anything in there? Other pec minor. Okay. Are you sure the right hand side is not worse? Oh my god. Wow, I know you feel that. I'm not gonna take a seat. Yeah. Jeez. It just feels like the rib is popped out this way. It could be because the shoulder is drooped forward more. So you've got to really practice opening this side up. Like, look away. Does that hurt with doing that?
Yeah.
I mean, just like that. Now look away. Do you feel it pulling?
Kind of.
But not bad?
Yeah,
okay.
Not bad.
Okay. I know when I press here.
Yeah.
Like, that doesn't count.
Yeah.
This here alone. I need to ask the questions while I'm not doing anything. Oh, man. I'm just doing some trigger point therapy. Okay, you can do this with the cane. You come in here and just kind of 1, 2, 3 off. 1, 2, 3 off. It's all in this corner here where your shoulder is like going around. I don't feel anything on the front, on the other side, maybe tiny little bit. You can also use a tennis ball up against a wall. Just going around in circles. Like I'm making a little circle here. The brachial plexus, the big bundle of nerves that exits your neck, goes down into here and right behind this. So this could be a contributing factor to numbness, tingling.
Okay.
Trust my camera crew here. Right. We're going to start here at the T12, which is the bottom of the thoracic spine, not the lumbar spine at all, okay?
Okay.
Come all the way back. This is all mid-back. Bend your knees. Look at that. Oh. And then arms out to the side for me. Open up the chest. Okay? This should feel mildly uncomfortable, if not moderately uncomfortable, because this is what you're lacking. I'm right on that spongy area in your back. You got to compress that fluid out, okay, to get the upper body back of the pelvis. All right, so I want to test it out here. You're going to roll to the side, roll to the left where your bad side is. Roll into it, because this is where you're going in the future. Yep, roll. Ow, 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 ow. And you're done. Now your body's gonna crack, and it resets itself. It's okay. All right, much better. All right, I just want to see if your body is trying to accept this new posture. It's trying. Okay. How are you feeling? Just kind of just take a couple steps around the room. You just kind of walk around. You should feel a little bit more flexibility on that. Yeah, you almost fell over. All right. Take a few seconds there. Yeah, I was going to say the left side, and she went, wee.
Yeah, I'm feeling my right down here.
Yeah, what's it feeling?
It's just, it's not hurting, but it feels like something has happened there, which is...
Well, you've had 5 knots.
Yeah.
breaking that up, and it was right along the nerve.
Mm-hmm.
So that's just a history of it. I call it misfiring, like in an engine, something misfires. The communication wasn't right, and it didn't know where to go, so it dispersed into the muscle, and it causes the muscle to cramp.
Mm-hmm. It feels a lot looser than, because I've always, whenever I touch here, it always like feels like I'm touching like a wall because it's how hard it is, but it feels a lot different now.
Grab the shoulders, like grab them, and then pull your head back.
See, that used to hurt. Yeah.
And now you can do it.
Yeah.
All right, we're on the right track. Okay, we're good for now, Linnea. We gotta do some more stuff.